again. Fantastic. Okay. Well, welcome. So glad to have you here for our second part of our two-part series as we talk about adult onset FAS. Now, when you first heard this, you might have been scratching your head on what FAS is, but it's called falling apart syndrome. So if you feel like you have any of this, you're in the right place right here. So today, part two, we're going to be tackling the lower body. So low back, legs, hips, knees, ankles, feet. Last week, we did record the video, so you can watch this on demand anytime, really. It's on our Facebook page, but simply in the email that you received this week to register for this webinar, at the bottom, the PS, there's a link directly to the upper extremities, FAS, the falling apart syndrome, for your neck, shoulder, arms, elbows, wrist, hands, things like that. So welcome, happy Thursday, good evening, everyone. We're almost at the end of August. Can you believe it? We're in a transition right now. We have been talking to many of our clients as the students that had been coming in over the summer, specifically the college students, have transitioned back to college. That's been an interesting transition. And we have, in a couple weeks, my kids are part of the Fairfax County school system, so they will be returning to school virtually. And so a lot of different things and moving parts going on in the world today, among other things. And I think we would all agree we do not have time to fall apart. Is that true? So tonight is about equipping you and empowering you with some really awesome information that you can start applying today to prevent yourself from falling apart, to get to the root cause of your issue so you can continue to live your life to the fullest and be as healthy and happy as possible. If that's you, then raise your hand, because that's why you're here tonight, and we're super, super pumped about this. So upper body, we were talking about the shoulder, things like that. We're going to pivot now to the hip and then the lower body. And all things are difficult before they're easy. How about that? Okay. So tonight, falling apart syndrome and hip, knees, lower body workshop. So lower extremities. So let me tell you a little bit about my story. And I just want to say thank you to my mom. And why do I want to say thank you to my mom? Because my mom took me to the chiropractor, my first chiropractic appointment. So let's rewind a few years ago. We're going to go all the way back to 7th grade. I guess I was 11 or 12 years old at the time. And my sport that I loved to play was basketball. I still enjoy playing basketball. In fact, my son, daughter, and I were playing this past weekend, and we have a lot of fun doing so. So I did not experience in 7th grade, I did not experience any specific injury. But I remember one time I came home from practice or a game and went to bed, all was well. And then the next morning I woke up and I literally almost fell over as I got out of bed. First time I ever recall this happening, where I go to step on my right leg and put all my pressure and weight on my right leg, and it just about collapses. It felt like there was a hot stabbing poker right into my hip socket. That was super painful. So I didn't know what was going on. And here I am, and I'm trying to get ready for the day and limp out the door with my backpack on. And my mom sees me with this and says, "Time out here. You're not going to school, and we're going to the chiropractor." Well, thankfully, my mom took me to the chiropractor. The chiropractor did a history, did an evaluation, did some testing, took some x-rays, and found a subluxation in my pelvis. And so the chiropractor adjusted me. I didn't understand what he was saying at the time, but all I knew is that he adjusted me. And then I was able to stand on my right leg without any pain, and I was able to get back to playing basketball that evening. And that was my first experience of my body healing without a drug after suffering some sort of pain. So Mom, thank you. If you're watching this now, or if you watch the replay on this. Thank you for taking me to the chiropractor, because who knew that I would become a chiropractor and help educate people with other challenges they're having in their body to help them overcome them without dangerous drugs and avoiding dangerous surgeries. So that's my story. I want to tell you that, recently over the years, with CrossFit and Orange Theory and half marathon races, among other races, I've definitely had my challenges when it has come to the performance of my body, specifically my lower body, hip, knee, ankle, feet. I've suffered from plantar fasciitis. I don't know if anybody here has, but that can be super painful. That's that condition when you get out of bed and you put your feet down on the ground, that first step right on the heel, sharp, intense pain. I've had some knee problems, and it all stems, it's like the right side. It was the right hip, it was the right heel, it's the right knee. So I'm very thankful for Dr. Travis and my chiropractic care and keeping me in line. And we're going to talk about this evening about the root cause of these problems. So we're not just treating the effects and maybe feeling better all the while the underlying problem is getting worse. We're going to get to the root cause of the problem. So so that's my story as it comes to lower body, and I'm going to share some very powerful information with you to help you achieve your health and wellness goals when it comes to this situation here. So F.A.S, the falling apart syndrome here. Okay, so as I was talking about these symptoms, remember, it's a body signal. That's what we call a body signal, is an alarm system in the body. Remember what PAIN stands for: pay attention inside now. It's the body's alarm system. And so when you have back pain or hip pain or sciatic pain or leg pain, knee pain, ankle pain, foot pain, you have bursitis, arthritis, tendinitis, any of the itises, that is a specific signal of your smart body to alert you that there's a problem. Now, what you do with it is going to determine your outcomes. Because if you take a look, I love this picture of the iceberg. And maybe you've seen this before. And if you have, it's great review. And if you haven't, it's a very powerful image. Because when people arrive into the office, it's what's above the water is typically what they think they walk in with. It is their symptom. It is the body signal that they're trying to get rid of. But underneath the water is the root cause of the issue. And if you don't change the root, you don't change the fruit. And what I'm saying is, it's wiser to get to the root cause of the problem than just mask or put a Band-Aid or a crutch around the symptom. This is what this image represents. The question is, are we paying attention? We know that modern life is unnaturally stressful. True or true? And that was happening even pre-COVID. Since COVID has hit, it's become, what do you think? I don't want to tell you. What do you think? Life has become more or less stressful? Many people are raising their hands in both hands saying, Doc, it's become more stressful. It's like throwing gasoline on the fire here. So we know that our body is stressful. The question is, are we aware enough of where our body is? Are we paying attention to the whispers that the body may be giving? Or are we reacting to the screams? So we want to be listening to what the body is saying and not just masking the symptom and ignoring it and hopefully thinking that it goes away on its own, but we're being proactive and fixing this and getting to the root cause so that you can do life on your terms, so that you can do whatever you want day in and day out, whether it's chores around the house, projects around the house, physical activity and exercise. More and more people are walking more, they're exercising more, and more than ever, people are investing in their health and wellness because they recognize how vulnerable that one virus can make a world population. So whatever we can be doing to strengthen our body, we want to focus on it. So we want to get to the root cause. And what do those body signals and what do those symptoms really say about our health? Well, let's take a look at this illness-wellness continuum. And on the far right side of this is high-level health and wellness. And on the far left side is what we call premature death, expiring before your time. And there's a whole gamut of information here we're going to get. But the symptom, if you look on the left side, there's a box that says a symptom. That's the hip pain. That's the knee pain. That's the ankle pain, the foot pain, low back pain, leg pain. Those are the symptoms. But before the symptoms show up, there's something that happens. It's the signs. And during our objective testing in the office, we look for signs in our office for a condition called subluxation. But a sign and a symptom, let's take a look at the differentiation of this. But a sign is, that would be like decreased range of motion in the knee or the hip or the lower back. It doesn't necessarily mean that you have a symptom with it, but it's a sign that there's an underlying problem brewing. In fact, most of the time people have a symptom and they show up in the office. It's been an underlying condition building over weeks, probably months, if not years, sometimes decades. But if we let that symptom go and we don't take care of the root cause of the symptom, our body starts to degenerate and deteriorate at a more rapid pace. Then we become disabled, meaning that we start to live around our problems and we're not doing what we want to be doing, which leads to poor health outcomes, which we can all agree that being here tonight, you care enough about your health that you want to make sure that you're doing everything possible for your health and being proactive. So we can see that on high-level health and wellness on the far right side, past the neutral, it's about awareness, education, and growth. You're here tonight to take away a nugget. Start applying it to your life. And then over the next 30, 60, 90 days and weeks, months, years ahead, become healthier and then stronger. Gain more awareness. And share this information with somebody that you love, because that when you teach this information to somebody else, you're going to own it more. But just know that symptoms are typically delayed, and we can't judge our health just based on how we feel. That's how we get into a healthcare crisis that we have today in the United States and around the world. Health is a lot more than feeling good. It's about functioning good and being able to do the things that you want to do on your own terms. So when we take a look at feeling versus function in the office, all our objective testing, we can tell more about your health based on function than feeling. Why is that? Well, did you know that only 10% of your whole nervous system is for pain? So by the time you have a pain in the body, it's typically a buildup of a bigger underlying problem over years. And then your body has lost the ability to adapt. If it's a macro trauma, such as like a car accident, a slip and fall, sports injury, okay. But that happens about less than 5% of these lower extremity issues are from the macro trauma. The lower extremity issues start to pile up because of the micro traumas over the years. The other parts of the nervous system besides sensory and pain, which is only 10%, the other 90% are the nerves that go to your muscles, which can impact the motor function. Those are the things that you can control, but it could cause spasms or tightness or fatigue or weakness. So when there's stress on the nervous system and the nervous system is unable to communicate properly, then the nerves going to the muscles can be impacted in a negative way. And then the things that you can't control, the autonomic nerves that go to your organs, they control things like sinus and allergies, your energy, your hormonal system, breathing problems, and then specifically in the lower extremity areas, those nerves go to digestion, large intestine, the bladder, the kidneys, the reproductive organs are all impacted by the health of those nerves that go down your leg. Those are the same nerves that go to your organs. So in our office, we do specific objective testing to find out if you have a condition called subluxation, and then we figure out what the root cause of it is, and then we start addressing the root cause, and we go through the three-legged stool of best results. Towards the end of this workshop and webinar, we're going to go through the three-legged stool of best results here. But see, one of the reasons that we're in this healthcare crisis is that we have the wrong definition of health, and we wait for symptoms to be an indicator for action. That means that we become very reactive than proactive. Now, I know if you're watching this, you're probably very proactive with your health and wellness, and I want to honor that. But for the majority of people, it's very reactive. So when there's a whisper in the body, we want to address it before it becomes a scream. Does that make sense? Because when you feel good, doesn't mean you're healthy. Think about this. Heart disease. By the time you have heart pain, is that an early or a late sign of a problem? That's right. It is a late sign of a problem. What about tooth pain? Is that an early or late sign of a problem? Definitely a late sign. What's an early sign of cancer? You're right, there are none. It typically takes 7 years of that disease growing before symptoms start to show up. So we can't just rely on the symptoms. We have to look at function. And as we go through the lower extremity here, and we take a deeper dive into the anatomy to help teach you about this, you're going to start to understand some of these signs that you might be seeing in your body over the years, but didn't know what it meant. So if we take a look at, we talked about last week, the shoulder is what's called an open chain, the open kinetic chain. So the open chain here means that the end of the arm is not attached to anything. It would be closed chain if you decide to go crazy and do a handstand push-up, but many people aren't doing those these days. But right here is an open chain. So that means you have a very shallow socket that the joint sits in right there, which means that you get a lot of mobility, but what becomes sacrificed in an open chain is stability. So it's more likely to be injured. However, with the hip joint is what's called closed chain, because then the foot is anchored, the extremity is anchored to the ground. And with the closed chain, you're going to have a deeper socket. It's going to be more strong, powerful, and it's going to be more stable, but you may not have as much range of motion as you would say like your shoulder. Your knee joint is like a hinge, and so is your ankle joint with some rotation in there. But it's mainly, their primary function is like a hinge. There's not much other movement in those joints themselves. So the mechanics, when it's a closed chain and you have symptoms downstream, let's just say all the way to the foot, that can be linked upstream to an other problem, such as your lumbar spine or your sacroiliac joint. So that's why as a chiropractor, we take a holistic approach and doing an evaluation to find out what the root cause of the problem is and not just treating the symptoms. Does that make sense? Because what we have found and research has found is that if you have a lower extremity issue, 9 times out of 10, it can be traced to your lumbar or low back spine and then the pelvis. It could be a disc issue. It could be a thinning of the disc, a bulging or herniation of the disc, a subluxation in the joint that's pinching the nerve that goes down the chain. So let's take a look at the hip problems right here, and specifically the hip socket. So I have an x-ray up there, which is very interesting. You might be wondering, what is that bright image there on the x-ray? Well, that is a hip replacement. And a lot of times when we see this in the practice, somebody comes in and the hip is too far gone, or they come in after the fact right here, we can see that, we start asking questions like, well, why did, let's just say that where the hip replacement is on the right side compared to the left. We start asking, well, why did the right side wear out and not the left? Why is it one side? And we want to ask the question is it an age issue, meaning that is the replaced hip older than the non-replaced hip? Well, of course, we know the answer to that. It's the same exact age. So what caused it? And a lot of times it has to, the hip problems stem from the pelvis being out of alignment and the lower back and the lumbar spine. What I can say is I've not seen a patient in my 12 years of practice that's come in with a hip issue such as to this extreme or wear and tear into the socket that also did not have wear and tear in their lumbar spine. They go together, they're connected. But this has a lot to do with the weight bearing alignment and the pressure and position placed on the hips. It has a lot to do with your gait, your symmetry, how your body is performing during exercise and activity, past injuries and traumas. A lot has to do with your lifestyle habits, so on and so forth. Here we start to get into the pelvis and the sacroiliac joint. A lot of people come in and they say, hey, doc, I have a hip pain, but they often refer to this part of the spine, not specifically within the hip socket. So let's talk about the sacroiliac joint, SI joint for short. You have two parts of your pelvis. It is the ilium. There's a left and then there's a right side. And in the center is the sacrum, which is an extension of your spine. And if either one of those bones get out of alignment, the ilium or the sacrum, it can cause inflammation and irritation in the sacroiliac joint, which then that irritation and inflammation signals the alarm system of the body called pain. And that SI joint, it's a very fibrous joint. There's a lot of ligaments around the joint. It doesn't have a lot of mobility, but there is mobility there nonetheless. The joint is shaped like a kidney. And it's very important with your mobility as far as your gait, your walking, so on and so forth. But this is a very common subluxation that people present with today because of how much sitting people do. The sitting, the chemical stressors that they put in their body, the mental, emotional stress, all starts to add up, and it can really attack this joint. So if you were to reach around the belt line and feel right along your spine, a lot of patients say, hey, doc, is that normal? They start to feel some of the anatomy, some of the bone protruding out, things like that. That's what you're feeling back there, is that sacroiliac joint. So it's the three parts right there, and it's very important as a foundation to your spine. If this foundation is unlevel, it's very similar to like a house being built on an uneven foundation. What is going to happen to the structure up above? Well, we know there's going to be a lot of compensation. Things are going to have to adjust to the position in a bad way because of the misalignment. But the bigger question here this evening as we go through this information is, what is the impact on the nerves that are traveling to the hip socket, to the knee, to the ankle, to the foot, to the IT bands, to the hip bursa, to the front of the leg, known as your quads, down to the back of the leg, your hamstring, into the butt, you know, that pain in the butt that we talk about. That would be into the glutes and the piriformis. Well, what about the calf and all the way down into the ankle and the foot? How is this impacting this? These stressors build over time and create a condition what's called subluxation. A subluxation is a term used in chiropractic to describe a joint misalignment that causes soft tissue damage. That means that the ligaments and the tendons around the joint become inflamed and swollen, and it can affect the disc tissues also. This is where we start to get, if the tendon is inflamed, tendinitis. We typically know tendinitis is that if you are actively moving a joint and there's pain, it means the tendon is inflamed. If there's pain in the joint and you're not actively moving it, then it's usually because if it's a ligament become sprained there. So it causes soft tissue damage. And inflammation, I want to tell you, is very healthy in the body in the short term. What becomes problematic is when the inflammation becomes chronic and long term, because it can send a whole cascade of information to your hormonal system, causing a fight or flight response in the body, which in and of itself increases the sensitivity of your pain receptors, leading to more pain. If not taken care of in the acute state, this is what turns into chronic habituated pain patterns in people's body. It irritates the nerve. It causes muscle spasm, because do you think it's a good idea to move a joint if it's injured? Probably not. So the muscles lock down. Through our evaluation in the office, we're able to determine if you have a subluxation on each visit. We do this through a specific exam process, which I'll talk about later. You also get lost imbibition, meaning that you lose movement, and the discs rely on healthy movement along the spine to allow a pumping mechanism of blood flow and allowing nutrients to keep the disc healthy. If we lose that flow of good nutrients and good healthy signals into the disc over time starts to break down and impacts those nerves that control your lower limbs. The joints become fixated, and it's just like a car that's misaligned. What happens to the tires? The tires wear unevenly. The spine starts to degenerate and decay, which leads to a condition called arthritis. Arth means joint, itis means inflammation of. There's an inflammation of that joint, and the joint over time starts to break down. The trauma creates this subluxation, which could be macro trauma, as we mentioned, could be car accident, slip and fall, sports injury. And I want to let you know is that this doesn't happen, it doesn't have to happen like within the last week, month, or so on for this to become problematic. In fact, when we do a history, we dive really deep with our new clients and finding out the root cause of the problem. Sometimes these car accidents, slip and falls, sports injuries that happened decades ago that seemed innocent, meaning that, doc, I didn't have any pain afterwards, or I healed up fast from it, meaning that feeling good doesn't mean that the problem was ever really addressed, and the body can be compensating because of the damage caused by the injury. More likely, it's the micro traumas that build up day in and day out. And I'm going to do a great job for you is if I can help you identify where some of your bad habits are, that could be slowly building up underlying problems that can lead to pain. When we're ahead of your pain and staying ahead of that, we're doing our best job. That's when we're on a wellness schedule, making sure that we maintain our alignments and that we're not falling off our regular routine adjustments. But we're going to talk about that during the three-legged stool of best results. So let's talk about now the knee problems. Knee problems, again, are very often related to the micro traumas that are happening day in and day out. There's some specific signs that we can find with these knee problems here that can give us clues of joint subluxation, misalignment, causing uneven wear and tear and eventually leading to a problem. But remember, as we go downstream from the spine, going into the hip, now into the knee, we must look upstream and find out where the root cause of the knee issue is. Because one of the ways that knee problems develop, I want you simply, you can do this at home. How about we do this right now, is just go ahead and then stand up. And then what I want you to do is just march in place and then go ahead and then stop. And then look down at your feet. Is one foot in front of the other? Is there one foot that's toeing out or flaring out compared to the other? These are all signs of a misaligned joint within your body. Most likely coming from the sacroiliac joint at the base of the spine and the pelvis, but also could be a misalignment in the hip, the knee, the foot, the ankle. So when these misalignments are occurring over time, again, just like the car being misaligned, it can cause uneven wear patterns within the meniscus, which are the shock absorbers in between the knees, and cause them to wear out unevenly, which then will start to lead to a problem on the inside of the knee, the outside of the knee, the front of the knee, could be right behind the kneecap or right below the kneecap, or also on the back of the knee. Those are the most common areas. You see, if you take a look at the x-ray, there's a normal joint space there. That dark space in between the bone is the meniscus and the fluid. That's normal. And everybody has a pattern to their knee. Males, females, sometimes the knees go in too much, sometimes the knees go out too much. You might hear knock knees, bow-legged, things like that. Everybody has a pattern to their knees, and if there is a misalignment in the knee, then the x-ray on the right, you're going to have a loss of joint space, which is now starting to move towards bone on bone. You're going to have a deterioration of the meniscus. You're going to have a deterioration of the cartilage there, and this can be very painful and problematic for my clients. So if you think about it, if there's a knee subluxation or underlying problem, well, we know that the joints around there are having to compensate for the instability in that joint. So we need to get to the root cause, stabilize the knee, fix the underlying root cause, so we can prevent the knee and other joints from wearing down too fast. So, and this will all be impacted because some lifestyle things would be getting up and down out of the chair. This would be getting in and out of the car. This would be simply going for a walk, going up and down stairs. So we do our postural analysis to be able to determine some of these signs that show up in the body that might be relating to your symptoms. But ultimately, we want to get to the root cause of the problem here. So when we move into the feet problems here and ankle problems, often there is a collapsing of the arch. With the feet, I'm not sure you're aware of, but there are actually 3 arches to the feet. Most people know about the inside arch, but there are 3 arches to help support your foot. There's also an arch on the outside of the foot, and then there's an arch that goes underneath the balls of the feet there. And if any of those arches start to drop, it can create a subluxation and affect the biomechanics from when you're walking, standing, those type of things. But when the arches collapse, you lose shock absorbing the system in the body, and now the foot, the ankle, the knee, the hips, the lower back have more stress and pressure applied to them. This can lead to problems called plantar fasciitis. It can cause bunions within your toes. It can lead to hammer toe, among other conditions within the feet. But this also can be stemmed from a subluxation within the pelvis. Because if your foot is flaring out, that typically means that one side of your pelvis is rotated out. If your foot is flaring in, sometimes you're toeing in, that means that your foot is turning in, and that can come from the pelvis. This is why it's a really good idea to get your children checked at a very young age, because we can identify these problems that may have started all the way from birth. When we talk about macro traumas, a lot of our first trauma and subluxation to our spine and body occur during the birth process. Research shows that 8 out of 10 children are born with misalignments. But if it goes undiagnosed, it goes uncorrected. And then we can start to build these patterns over time. Or we might have had an injury previously, but it was never properly evaluated. Maybe so you went to see somebody, but they didn't look deep into it. They said, oh, you feel good? Just call me as if you have a pain. But over time, this can develop into bigger problems. So there are certain signs within the ankle to show us there's a problem. That black line, I want you to think about if you feel the back of your heel and there's a big tendon right there, it goes down from the calf and inserts into the heel. That's what's called your Achilles tendon. So if you're walking, if you're biking, if you are running, if you are jogging, if you are lifting weights, all these things that I'm talking about will be impacted by your alignment in these areas. So in the center is a normal foot. You have the Achilles and then the calcaneus. The calcaneus is a very hard, rigid bone that's your heel. And then the talus within the ankle is where the hinge joint connects to your leg. This should be a vertical line. But a lot of people, we find, lose their inner arch and then their foot starts to pronate. So you can see that as the far left image. And when the foot starts to pronate, it puts extra stress on the Achilles. This can lead to Achilles tendonitis or pain on the back of the heel, not on the bottom of the heel. Or unfortunately, if it goes on long enough, can lead to a condition that would rupture the Achilles tendon. On the other side, which is less common, is supination, but that is when the foot rolls outward, where you start applying a lot of pressure on the outside of the foot. This can lead to other ankle issues and stability. But a lot of this, we go upstream. Remember the closed chain, which we can identify as the root cause of the problem to improve function downstream. So let's face it, growing old is not for sissies. Can I get an amen on that one? But here's the empowering statement of all this, is that you are in control of how fast your body ages. Let me repeat that one. You are in control of how fast your body ages. I don't want you to think that you're a victim here, that you inherited some bad genes, that you're surrounded by some bad germs, or you have some bad luck and there's nothing you can do about it. In fact, there's a lot of research in the world called epigenetics that has shown that you can actually influence your health outcomes and the expression of your genome based on your lifestyle habits. So if you're unhappy with the outcomes that you're receiving currently with your health, or you want to step it up, then what you need to do is look at what you're doing day in and day out, because you can't do a health outcome. You can only do a series of actions and behaviors day in and day out, repeated consistently over time to lead to those outcomes. But the good news is that 25% of your health expression is based on your genome. 75% is your daily lifestyle habits. We're going to talk about that more when it comes to the three-legged stool of best results here. But I want to let you know that you can be proactive in taking action to continue to deposit health, make deposits in your health and wellness bank account. Can you tell me what happens if you make too many withdrawals from your financial bank account without having enough deposits into your financial bank account? Yes, you get into the red. There's a debt. You're getting behind. We don't want to get into that situation. We want to be doing more than what's being withdrawn. And the cool thing is that you don't have to be perfect with this. It's all about progress. Because I want to introduce concepts called entropy and syntropy. Are you familiar with those concepts of physics? Here's the deal. Is that entropy says is that the natural order of laws of life, everything in life, including your health, is for breakdown, deterioration, and to fall apart. If you did nothing when it comes to your health and wellness, that is your natural path. Deterioration and falling apart. It's like if we abandoned this office and this building for like 18 months, 24 months, and we came back, this place would look quite different than it is today. If you want to grow your health, if you want to keep your health, if you want to be as healthy as possible, that means that you must, not you hope to or want to, but you must, it is a necessity to be pouring in energy toward your health and wellness. I know many of you are already doing that. I know some of you are looking for a better way. You're looking for a change in your life because you're not happy with your health outcomes. If you are happy with your health outcomes, then we continue doing what we've been doing that got you there. And then we can always add on to help improve from there. But if you keep doing what you've been doing and expect different results, that's the definition of insanity. But syntropy is putting energy into the system toward your health and wellness that causes things to come together, that there's order, there's growth, there's progress, there's improvement. There's a synergistic effect of things coming together. By matching up, coming into this office, getting proper alignment to reduce and correct subluxation, and making sure on the outside that we're eliminating bad habits and putting in the energy of doing things that help support your chiropractic adjustments. That's the difference between entropy and syntropy. We must put in the work. There's no easy solution to this. There's no magic pill. Slow but steady wins the race. Slow but steady wins the race. That's what I want you to remember. Progress, not perfection. So when it comes to self-care here, there's a few things. Obviously, chiropractic adjustments and maintaining your alignment is vital here to the health of your lower extremity. But there's some things that you can be doing on your own, such as foam rolling. Now, this is a love-hate relationship. I know. I hear it all the time. Doc, no, the foam roller, no. So I get it. Now I have my other clients like, Doc, I don't know what I would do without it. So it's a love-hate relationship. But the foam rolling helps with stretching out and lengthening muscle groups. We could do that along the spine, those paraspinal muscles. We could do that with your glute medius, minimus, maximus. Those are some cool names, right? The piriformis. The IT band, that's that band that runs alongside of the hip down into the knee. That if that gets too tight, that can inflame a bursa, which is a cushion between the tendon and the hip, known as hip bursitis, which can be super painful. We can work on the quads, which is the front of the thigh, the hamstrings, the calf muscles, the bottom of the feet. Those are all great things to do, to stretch out those areas, to break up scar tissue and adhesions that form into the muscles, that just over time start to accumulate. And we can work on those things called trigger points, those knots, those very poignant, painful areas within the muscle belly can be helped here. Exercise, so there's a three-legged stool of exercise, there's strength, there's stretching, and then there's cardio. Putting those three together is going to lead to our best health outcomes. And then if the joint is inflamed, if it's an acute situation, it's swollen, then ice can be very helpful in the pain management process there to help you feel more comfortable. Those are some ideas when it comes to self-care. I have some very specific hip and low back and lower leg exercises that I have a lot of them. It goes beyond the extent of this webinar here. But if you would like them, I want you to raise your hand and I'll be happy to email those out to you after this webinar so that you can have this information to help support your chiropractic adjustments outside of the office. Because I could tell you what, if you take care of your health, it's going to take care of you. You take care of your body, it's going to take care of you. And you can have longevity, you can have mobility, you can have strength, you can be doing the things that you want to be doing and participating in life. Because let's face it, it's no fun to be playing on the sidelines of life. You want to get out there, you want to get out of the stands, and you want to be able to use your body to enjoy the things that you want to be doing. So here's time that we're going to bust into one of the best exercises that I know to help with mobility, stability, strength in the lower body. This works all those lower muscles, your glutes, your quads, your hamstrings, your IT band, your calf muscles, the bottom of your feet. So everybody, let's hop on up. And how cute is this kid? I can't take credit that this is our kid. We have, I think, the cutest kids on the planet. But if you're a parent, you probably feel the same way here. But let's go through some principles because this kid's got it right, okay? And a good squat, it's child's play. I want you to see this child's face. And what I'm excited about as I talk about it is he's smiling, okay? We want to be smiling. We want to be having fun doing this. So the head is upright so we can look forward. That smile brings a relaxed sense to the body. He's got a big chest. The torso's upright. The back is straight and solid. Knees are over and tracking the toes. So you don't want your knees to go in front of the toes. Your knees are apart and the hips are below the knee. Body's in balance. Feet shoulder width and flat on the floor with the weight on the heels. This is the perfect squat right here. So look, I know we have a wide range of people on the call here, the webinar. So you just go, you play to your strengths and where you're at, okay? There's no sense of causing a subluxation, trying to do a demonstration on a webinar. You do what you can. If you can't do the squat at this time, that's all right. We're going to give you a pass, but we're going to have a conversation, you and me, on your next appointment in this office. So let's go ahead and stand up, and I'll show you some modifications that you could be doing here. So basically, the way I look at it is you want your weight of your body on your heels, knees, make sure they don't go over the toes, keep your chest and your body upright, and then you go and you're sitting down like you're sitting in the chair. So really the power and the strength comes from your glutes, your buttocks right here. As my trainers taught me, squeeze the cheeks. The power is in the cheeks, so you're going to squeeze the cheeks. Hopefully that one got you to smile. So your feet are shoulder width apart. Your toes are just slightly flared on this one. Your feet are slightly pointed out. And then you're just going to go like sitting in the chair, and then you're going to come up. And ideally, where you want to start working on this is to do 20 of these per day. Your power when you come up, squeeze the cheeks. If you're not squeezing the cheeks, you're going to strain your back. You're going to cause knee stress, among other areas of your lower body. From the side view here, when we look, we're coming down and back. See the upright posture? Keep your head forward. Make sure you have that childlike smile on your face. And you're going down, and then you're going up. if you ever want a warm-up exercise, a dynamic warm-up, that is a phenomenal exercise, that in and of itself. So if you did nothing else from this workshop here, and you decided to add in 20 squats per day, I can just tell you, you just did a whole hell of a lot of good for your body and your longevity and well-being. If you're having an issue with your foot, ankle, knee, hip, lower back, the SI joint, when you're doing this, we need to have a conversation on your next appointment. So we can work towards getting you to be doing this right there. But this is how it's going to keep your body healthy and strong. And if you serve your body, it will serve you. So there's professional care. We talked about self-care. And then there's professional care out there. ART, active release techniques. The massage therapists are really great at getting in there, loosening up the muscle. We love massage therapists. They complement chiropractic very well. They go hand in hand, pun intended on that one. And so when the muscles are tight and there's a lot of chronic muscle issues, we refer our patients out to get massage therapy. It could be a very important and vital part of their care. We love physical therapists. Physical therapists work on helping with the specific site and the joint and addressing the mobility and range of motion issues and strengthening of specific joints. And then, your MDs, what do your MDs say when you go to them with these issues? Go home. I hear that time and time again from my patients. What are you doing here type thing? Or then they start to give other options. But with all this, my question is that are these professions really dealing with the root cause of the problem, or are they dealing with the effects right there? And I'm proposing that how do you correct the problem? Well, there's a better way, meaning that you get to the root of the problem. So allopathic options, you go see your MD. Heat and bed rest, we know those aren't great options. Drugs, there's side effects with drugs. Every single drug you take, there is a side effect. And we know that there's an opioid crisis out there today. It's sometimes the drugs work so dang good that, you feel amazing when you take the drug, but all the while, the underlying root issue is getting worse even though you feel better. Steroid injections, pain management, dangerous surgery, there's got to be a better way. So through chiropractic, we work on correcting the root cause of the problem. So we have long-term help to our lower back, to our pelvis, to our hips, to our knees, to the ankles, to the feet. And then we follow the three-legged stool of best results here. What we look for as a chiropractor, as I mentioned before, is a subluxation. The subluxation in the lumbar spine can impact those nerves that go to the lower extremity and cause lower extremity issues. So with the closed chain, which the lower extremity is, if you have a foot, ankle, knee, hip problem, you must look up the chain into the lower back, into the pelvis area. So how do you know if you have a subluxation? Well, in our office, there are 5 objective criteria here that we do. There's instrumentation. So if you've had these nerve scans in our office, we know that we can find out the root cause of the problem by doing this check on the nervous system, where we look for inflammation on the nerves. We look for muscle tone and spasm along the spine and pelvis. And then we also can do the heart rate variability, where we're measuring your body's adaptability to stress. Then during the chiropractic portion, we do motion and static palpation, where we're feeling those individual joint segments. We can see if they're moving too much or too little, if there's inflammation around the joint, if they're stuck, things are tender. We take posture pics. We look for the signs of the body to point us if you have subluxation. Then we confirm everything on X-ray. The hip, knee, ankle problems, most commonly we find the subluxation at L3, L5, sacrum in the sacroiliac joint. But make no mistake about it, when there's a subluxation at those lower levels, those impact the nerves that also go to your digestive system, specifically to your colon and large intestine, which could cause symptoms like diarrhea, constipation. They can cause bladder issues. They can cause reproductive organ issues. kidney issues, adrenal gland issues, all those things in the lower spine too will be impacted and can be affected. So we do objective testing, which includes looking at your feet. I'm going to tell you that if you are a current client and you have not had this test done, I encourage you to have this test. It's in the office. It takes about 5 to 7 minutes tops. And then let's measure objectively the 3 arches on the bottom of your feet, because there could be a collapsed arch that is causing a subluxation in your lower extremity that is disrupting the alignment and the adjustments in your pelvis and then in your shoulders. The test doesn't take very long, but then it reveals a lot of information. If you're a new patient, this will be done on your first visit into the office here. So the 3 steps to correct the cause, well, this is about breaking the bad habits that we talked about. This constantly we need to constantly have a discussion about it, because we don't have a 5-minute conversation about breaking bad habits and then all of a sudden all the habits are broken. It's like brushing and flossing your teeth, right? Your teeth get dirty every day. We need to make sure we keep them clean. This is like going through like a checklist throughout the body. Here's where the most common bad habits, if you're taking notes, if you're a note taker, write this down right here, is that sitting too much. Sitting is like sugar to your spine, and like what sugar does to your teeth is that's what's happening to your spine. It causes to wear down fast, causes decay faster, causes to break down faster, causes joints to fall apart faster, which will impact those nerves that go to the lower extremity. And remember, if you're not moving, we need to be moving. Life is motion and motion is life. We need to be looking at then breaking then those stress habits and making sure that we're implementing good things to help combat mental and emotional stress. We need to be eliminating a pro-inflammatory diet. We need to be eliminating those foods that chemically increase inflammation in our body. We need to be looking at our weight and achieve an ideal healthy weight, because just 1 extra pound that you carry around is like 4 extra pounds to your knee is what the research shows. 2 extra pounds of weight you carry along is 8 extra pounds to the knee, and so on and so forth. So it has an amplified effect. Not getting enough sleep and being dehydrated will all cause more problems in your body and delay the healing process. It will impact your healing results from your chiropractic adjustment. So those are the bad habits that we need to work on breaking. Remember, I said progress, not perfection. The next thing is we need to add specific exercises to help strengthen the muscles along the spine, to help prevent the subluxations from coming back and keep your body better aligned. And then specific chiropractic adjustments. You know, I didn't know what my chiropractor was explaining to me when I was 11 years old, going to the chiropractor because of a hip pain. All I know is he adjusted me and I felt better and I was functioning better. But I can only imagine, knowing what I know now as a chiropractor and what I teach you and my other clients about their health and wellness, I can only imagine what would have happened if my mom hadn't taken me to that chiropractor for that visit. Thanks again, Ma. Love and appreciate you. So we have a success story, and this will be interesting because I want to see if I'm able to play this video so you can hear it here. If not, then I can pull it up a different way, but I'm going to hit play. And on your computer, make sure the volume is up, because when I was testing it here, it seemed pretty faint. But this is Derrick's success story, and I hope you can hear it, because it's a really amazing testimony to the power of chiropractic, changing habits outside of the office, and starting to regain your health back so you can live the life that you want to be living. So let's tune in to hear what Derrick has to say.
Hi, my name is Derrick, and I want to tell you a story about why I'm getting care at chiropractic. Earlier in 2019, I had a herniated disc in my L4, L5, and was suffering from a lot of pain that shoots down my legs to my foot. I had to see a surgeon, and he suggested surgery to remove, the protrusion on the disc. But thanks to my friend Dennis, he referred me to Dr. B here at Pure, and I started a intensive treatment since June of last year. I'm a runner. I run long distances, and my favorite distance is 10 miles every year in Cherry Blossom in DC. I barely was able to run that race last year, even though I was suffering from this herniated disc. I completed it. After that, I wasn't able to move that much anymore. I was taking Tylenol and pain medication just to relieve the pain. But I didn't want to get a surgery, so I saw Dr. Brandon immediately, and we started a treatment. He felt that we have a better than 50-50 chance of getting improvement. So I trusted him, and I started a treatment, starting with a laser treatment for a few months. That's intensive, and then along with the adjustment, twice a week in the beginning, and then reduced down to once a week. So here we are, August of 2020, a little over a year later. I'm pain-free, fully recovered. I'm able to run if I wanted to, every day, but I do that every other day now. And I'm averaging 15,000 steps a day without any stress or pain in my lower back, L4, L5. So my testimony is that, once you see Dr. B and he looks at it, not everybody can be treated, but in my case, he was able to treat it, and I'm back to full recovery, and I'm able to resume my running life, which is my passion. So I'm very thankful for Dr. Brandon and the whole staff here at Chiropractic.
Awesome. That's super powerful and super moved. And I'm reminded why I get out of bed every single day to come to this office and help each and every one of you. This is my passion. This is my calling. This is why I was put on this planet, is to help your body heal naturally so you can experience full health at whatever phase of life that you're in, because life's too short not to. You deserve health. You deserve wellness. And what I do know is it takes time. It takes time. Healing takes time. Health and wellness takes time. If you want health and wellness, and that's your end game, and that's your result is optimal health outcomes, it takes time and effort and work. I'll come alongside of you. I'm your health coach. I'm your accountability partner. We work together to work towards your health and wellness goals. So how do you know if you have subluxation? Simply, you get checked. So how about you? If you're a guest here and new to this office and have not been in, I'm going to invite you to come in. And if you're currently a client, how about your family? How about your kids? If you have a family member or a child that has not been into this office to get checked, I encourage you to take me up on this offer, because a lot of times these problems can start at an early age. If we find a problem early, we can work on correcting the solution and have make sure that we do the best that we can to help prevent any future problems and optimize health outcomes. Normally coming in to get all this testing done is $375. Our special offer for being here this evening is $79 to come in. That includes everything plus the doctor's report. The reason why we make this offer when we do these talks to you, to our community out there, is to lower the barrier, because I know there's barriers for you coming in to get checked, and one of the barriers is money. So we're just going to push that to the side. It's only $79 to come in and get checked, plus you get the doctor's report stating what the findings were, if we can help, what's wrong, how long is it going to take, and then we go from there. If we can't help, we'll tell you that too, and we'll point you in the right direction. But what is probably the most heartbreaking when I meet anybody for the first time in this office, how come nobody had told me this before? If I would have known this 5, 10, 20 years ago, I would have done this earlier. Well, the next best time is today. Today is the best time to be investing in your health. And if you're currently a client, just keep investing in your health and doing those things that you know you need to be doing to help support our work in the office, outside of the office, so it helps lead to best health outcomes. How long does a visit take? If you're wondering, the initial visit, 45 to 60 minutes of your time. It's not that big of an investment as far as time. Financially, we remove the barriers to come in and get checked, because this is one of the things that leads to our poor health outcomes as a society today, and our healthcare crisis that we're in, is A wise doctor once said, procrastination is the thief of health. Maybe it will just go away. Well, what I do know is this: ignoring a problem doesn't help it go away. But what I do know is finding out what the root cause of the problem is, being proactive and doing everything that you know you can be doing to help improve your health and wellness is the path to go and save time, money, and energy in the process here. So schedule a consultation. If you're a new patient, if you want to get a family member in, let's do this. Email lynn@purechiropractic.com, LYNN. Tell her you were on the webinar this evening. She will give you the new patient special. If it's a family member, when we see you in the office on your next visit, let's get that family member scheduled, and don't be afraid of being a beginner. Okay? The path, what did they say? You know, the journey of 1,000 miles begins with one step. Looking ahead, I just want to say that next month in September, can you believe it's September already? We're heading into the fall season, and super pumped, super excited to be bringing you chiropractic, and children is going to be our topic in the month of September. So stay tuned. So if you're a mom, you're a dad, you're raising a family, you know other people that are raising their families, and they know that health is a priority, and they want to make sure that they're doing everything that they can to improve their family's health and wellness, especially during these crazy times, you're going to love what we have coming forward ahead. This webinar will be recorded. You can review it later. There's a lot of great information. And on your next visit, I look forward to hearing the nugget. What is the one gem? What is the takeaway that you're going to start implementing today to move you towards optimal health and wellness? Thank you so much for your time this evening. I appreciate you being here. Have a great night. Love and appreciate you. We'll see you soon in the office. Thank you so much.